Good afternoon, and welcome to Ask the Doc. This is the live show where we give our audience the opportunity to ask questions of our experts in Alzheimer's disease and related dementias. My name is Dr. Megan Whitbracht. I'm the Associate Director of Education at UCI Mind and the host for today's program. For any of our new guests, UCI Mind is part of a national network of federally designated Alzheimer's disease research centers. It's funded by the National Institute on Aging, which is part of the National Institutes of Health. Today, we're going to be talking about clinical trials for Alzheimer's disease. And I can't think of two better guests than the guests I have today, Dr. Melanie Tollickson and Beatrice Videz. Dr. Tollickson is a family nurse practitioner who received her nursing degrees with an S at UCLA, Cal State Long Beach, and Cal State Fullerton. Beatrice Videz is a registered nurse and UCI graduate who holds a master's in nursing and is currently working towards her nurse practitioner license. Welcome, ladies. Thank you.
Thank you for having us.
Thanks for having us, Megan.
Absolutely. And thank you to our audience. I would encourage you to ask questions. You can type your questions in the comments below the video, and I will be able to answer them in the order or however appropriate they are. So with that said, let's get started. Okay, Beatrice, let's start with you. How long have you been at UC Irvine, and what is your role here?
So actually this year I will have 20 years of service with UC Irvine. It will be 20 years that I've started working here, and my role has changed over the years, but more, I would say over the past 10 years, I've been the lead nurse, clinical trial coordinator for all of our trials.
Very good. And Melanie, so you're a nurse practitioner, you have your doctorate in nursing. Why did you choose to go into research instead of clinical care?
So I've been a nurse for a long time, and I've done different roles in nursing, from bedside nursing to nurse educator to nurse practitioner. And kind of throughout that whole time, I've realized that research has kind of been the cornerstone of nursing. In general, like all our clinical decisions, all our procedures are all based on research. And so for many years, I had been passing meds, ordering meds for patients, and it just feels like the right trajectory in my career and very fulfilling to be part of a team that's helping to develop new treatments, new medications for diseases. So it's kind of, I've always been part of research on the clinical side, but now it's kind of fun to be part of a team where we're actually doing clinical trials with patients. So very happy to be here.
Absolutely. Okay, so there are several different types of studies that people can be a part of. The two main types are observational and interventional. Melanie, can you tell me the difference between the two types of studies?
So the main difference between the two are the inclusion of a treatment or an intervention. So in an intervention trial, there is a treatment or medication or maybe an exercise program that is studied to see if it can make any change. Where an observational study is, there is no treatment, there is no, program to change something, but you still learn things from that, and you're kind of just observing the subjects and their behavior. So the main difference is that that intervention, that treatment or medication that we're studying between the two. And at UCI Mind, we have both.
Mm. And then in the context of Alzheimer's disease, what is the hope with an investigational treatment? That it'll reverse the symptoms, that it'll stop the symptoms, that it'll slow? What's the hope?
I think over the years that the goals of Alzheimer's clinical trials have changed. I think the current goal is slowing down the progression. And I think stabilization is ultimately the primary goal. Just over years, we've worked towards completely halting disease progression, and we haven't made much headway in that direction. So if we can slow down the progression of the disease and get people to a point where they're stabilized and can continue to live lives that have quality, that seems to be the goal that most clinical trials set forth currently.
Okay. And now when we're talking about clinical trials, the term randomization or randomized controlled trial comes up. What is randomization?
So the main purpose of randomization is really to decrease or to prevent any bias, right? So randomization is often used in clinical trials. For example, if it's a treatment trial, a person will have, be randomly placed into either an intervention group or into a control group. And it's at random. So it's sort of like a flip of a coin by chance that a person would get placed into or assigned into a certain group. But randomization helps improve the rigor of a study, helps provide a stronger evidence for the study. And at UCI Mind, all our clinical trials have randomization.
Very good. Another term that comes up is placebo, and I know that kind of fits in to randomization. And can you talk about placebo?
So placebo, very much like what Melanie was saying, is the control group. So this group, depending on the nature of the study, either does not receive the medical treatment, they will receive a sugar pill, for example, or a fake pill, excuse me, that looks identical to the active treatment. Or if we're doing an infusion study, the infusion looks identical to the active treatment. But the reason we do this is to try to identify if the active medication is more effective and is able to produce more of a change when compared to that placebo or to that control or non-treatment group.
Yeah, very good. Okay, I know that at least when I came to UCI Mind, I had a lot of misconceptions about participating in a clinical trial. And it wasn't until I saw what actually happened that I thought, oh, this doesn't seem as scary. Beatrice or Melanie, can you tell me what happens sort of in the course of a clinical trial, participating in a clinical trial? What's involved?
Do you want to take a stab at it? Or you want me to go?
Yeah, I'll add to it, yeah.
So in most clinical trials, procedures vary from study to study, but for the most part, people come in for what we call clinic visits. And during these visits, you see practitioners like Dr. Talixon or one of our neurologists or geriatricians, or even members of our staff team, our study coordinators. And during these visits, we perform everything from interviews to some memory testing. We may also collect blood samples, urine samples. We may collect some imaging of the brain, like MRIs or CAT scans. And then, of course, we discuss the treatment. So if you are in a trial where you're getting an oral pill or medication to take by mouth, we go over the medication with you in person, and then you take it at home. But if you're getting a medication that we give here in the clinic setting, like an infusion, then that might be part of the procedure for the day.
Okay, very good.
And I think clinical trials last over several years, usually. So as a patient, you really get to meet and get to have a relationship with us, the research team. So we get to really get to know the patients. We get to know your families. We see you, quite often, monthly, for some studies. And so we kind of, watch over your health as well. So if we see anything, off on your labs, or if there's something, that you're going through, we're there to help you as well. And we will kind of are that extra layer of health monitoring. I always kind of like to say, because when you're part of our trial, you're part of our family. So we build a really strong relationship with you guys. So it's nice.
Yeah, I very much feel the same way with Dr. Talixon. Not only do you become one of our research participants, but because these studies last for so long, sometimes we do become a part of each other's families. But we do add that extra layer of, health monitoring, because unlike when you go to your regular doctor's office, you go to your doctor's office because you find something wrong with yourself, or you notice something off with yourself, versus when we see you, we're actively looking for those things because we want to make sure we can catch that early if it's something to do with the study treatment, or even if it's just part of your general basic health needs. We would provide, we want to make sure that you are notified right away.
So let me clarify something.
Sure.
Do the investigators in a clinical trial offer clinical care as part of the trial, or how does this work?
So not necessarily. They don't offer clinical care in that, let's say, for example, we find something wrong or abnormal in a blood test, like a urinary tract infection. Dr. Talixin or one of our other providers would contact you as a participant and let you know about the finding. And we would ask that you go back to your treating medical team, your primary care doctor, or if you're seeing a specialist, a cardiologist, anything like that, go back to your medical team, and then they are the ones responsible for providing you with the care that you need for that condition.
I see.
So it's a little bit not exactly what you would get from your regular doctor.
Yeah. We don't treat, if we find an incidental finding in a lab, we don't treat it, but we will definitely let you know about it and make sure that you follow up with your doctor and stuff.
Okay.
And that's just, making sure that you're healthy.
Kind of like an extra set of expert eyes, kind of.
Yes.
Absolutely. Yes.
Good. And now, what are the different phases of a trial, for example, that either one of you lead, like screening? Like, can you go through what the phases of a trial are?
Sure. So most studies begin with the screening phase, and during this phase of a trial, we are trying to determine if you fit the criteria or if you meet the criteria for the study. So excuse me, most studies have a list of criteria that you must meet because you want to make sure that you are the right fit for the study, but that the study is also the right fit for you. So there may be medical conditions that are not allowed as part of the study because the study may put you at increased risk for another medical condition. Some medications, for example, are excluded as part of participating in certain studies. So we look for all of those things before someone enters the study. So again, we're kind of checking off a checklist to make sure that you meet all of the criteria, determining that you're healthy and eligible to enter a study.
Very good.
And then once you enter the study, then we go into the treatment phase, where we either randomize you into an intervention group like exercise or treatment or medical device. We don't do medical device studies, but in some other centers, they do medical device studies. You're randomized into one of those treatment arms, and then we begin to do the monitoring.
Very good. And then I've heard also about an open label phase. What is that? Is it a part of all studies?
Dr. Talixin?
Open label, not necessarily, but an open label is where the double-blinded or the interventional part of the study is completed, and after some analysis of the data, they find that the medication is safe enough where everybody will be able to be on the medication. So we currently have a study like that where all the patients have finished the double-blinded randomized study, and then they're moving on to the open label where they're all the subjects, all the patients are getting the actual active medication. So that's exciting. And so when that moves into that trial, that, type of a study, the medication is showing, good evidence that it's working and that it's safe for patients, that they're going to be on the open label, that they're getting the actual medication. So it's a good sign. But it's not quite approved yet for sure, but it's on that right, direction. And that's why we continue to study it.
Right. Okay. And those open label phases also provide us with additional information because you're examining your two groups. You're looking at those individuals that were on active drug versus those that were on a placebo. And by everyone shifting onto an active medication, for example, you want to see if those individuals that were originally on placebo can then catch up, so to speak, to those that were all along on treatment.
Good point. Yep. Very good. Now, to join a clinical trial for Alzheimer's disease, do you have to have a clinical or a cognitive impairment?
Not necessarily. Again, it depends on the trials. Sometimes I think for our group, our studies range For though we are seeking individuals who don't have any cognitive impairment, we have some studies where we do look for individuals that have some cognitive impairment. And then, of course, we may have other studies where individuals can be more farther along in the dementia spectrum and have a diagnosis of Alzheimer's disease.
Great. And what are those trials called for people who don't have impairment but are at risk for the disease?
Do you want
Presymptomatic.
Mm-hmm.
So those participants would be presymptomatic. So so for example, we have a study called the AHEAD study, and that study is a big clinical trial we're screening for right now. And it's looking for presymptomatic patients where they not necessarily they don't have any memory impairment, they don't have a memory diagnosis, but they may have some biomarkers that may put them at risk, such as amyloid through amyloid imaging, APOE risk.
So genetic biomarker.
Yeah, genetic biomarkers. So that study is looking for presymptomatic patients that have significant biomarkers that put them at risk for developing Alzheimer's. So that's currently a clinical trial study that we're screening for.
Very good. And how do they test for whether you're at risk for Alzheimer's disease, for those amyloid and tau?
So for those types of studies, during the screening process, individuals would undergo certain procedures, either a blood test or specifically we do PET scanning. So PET scan is a type of brain imaging where individuals will receive a type of contrast or a dye that goes into a vein, and then we can highlight, so to speak, some of those biomarkers in the brain. And then that image is sent to a central group who reads it, and then they will tell us if someone is at higher risk for developing Alzheimer's based on a level, threshold or a level of amyloid that's found in the brain.
Very good. And then can you tell me a little bit more about the AHEAD study, how long it lasts, how long it lasts, what are the procedures involved, and how someone could sign up for it if they were interested?
So the AHEAD study is approximately 4.5 year long study. It's quite a lengthy study, but in the grand scheme of life, 4.5 years is pretty short when you think about how long someone can live with Alzheimer's disease. So it's a 4.5 year long study. And sorry, I forgot the second part of your question.
What are some of the procedures? We had talked more generally, but specifically for this study, what are the procedures? Yeah.
to get involved in the study, you would undergo a consenting process. So of course, with any of our trials, any clinical research study, there's a consenting process. So we provide you with a copy of the informed consent form that goes over all the details of the study. One of our clinicians, like Dr. Talixon, goes over that document with you in person to make sure that you fully understand what we're asking you to get involved in. Once that document is signed, then we may begin with a blood draw. And from that blood draw, we can determine if you are at higher risk for having amyloid in your brain based on a blood test. If you are eligible, then you move through the screening process. So from there, we may move on to some cognitive testing, an interview, the PET scan to further look for a presence of amyloid. And then it just goes on from there. MRI, lumbar puncture if you are interested in participating in that, tangle or a tau PET scan, and then it goes on and on. A physical examination, blood collection, those sort of things.
Yeah. And then just to add, so the AHEAD study is looking to recruit healthy older adults ages 55 to 80. And we are also heavily recruiting any people from underrepresented groups like Asian Americans, Hispanics, African Americans. We're just trying to increase, the diversity in our pool. And what we're studying is it's studying an actual medication. So it's the medication is called BAN 2401. What's the
lecanemab?
Lecanemab is the name. And it's an IV infusion drug. So depending on a person's amyloid level, they would be placed into two groups. And so one group, they would be getting infusions 2 times a month for about 2 years. And then the other group, based on their amyloid level, would be getting infusions once a month. So that's for a total of 4 years.
Right. And then, of course, both arms have a placebo group.
Yeah. Yeah. And they're randomized into the group.
Right.
Bringing it all back around. That's good. So you said the one group would get infusions every 2 weeks for 2 years, and then they would move into a once a month type of pattern?
Correct.
Okay.
Correct.
Yeah. And something also to add is that in this trial, in the screening process, patients will be notified, if they want, they'll be notified of their APOE gene information. And if they meet plasma criteria, they'll be going through an amyloid PET scan where they'll be disclosed whether they have no amyloid, intermediate levels of amyloid, or elevated amyloid. So they actually will get information, which is nice to know. And they're, again, just biomarkers. It's not a clinical diagnosis, but it is continuing to help us learn more about this disease.
Very good. Okay, now what if someone says, well, I can't participate in research because I can't get to your center? Do you offer anything for people who can't drive or don't want to drive?
Yes, absolutely. We are very lucky to have a close relationship with a private transportation company, a very small transportation company, but what makes it very nice because we have consistent drivers. So these drivers, we notify them of your upcoming visit. We provide them with your contact information and where you live. They pick you up at your home, bring you to our visit, and then when you're all done or you've completed your visit for the day, they will also take you home. And that's at no charge to you as a participant. That's covered under our funding for the research study.
Very good.
Also, with the COVID, we've had a lot of accommodations that have come up, like remote visits. So some of our studies allow for interviews to be conducted via Zoom, via phone, those sort of things. So COVID has done some nice things for us.
Absolutely. Okay, so what if someone says, well, I want to participate in research, but I don't know if I'm ready for a clinical trial or an investigational therapy. What are some other options that are available at UCI Mind?
Well, we do have the observational longitudinal study. And so that is not an intervention study. And it's where we follow you over time. And so what would include in that study is that you would come in once a year and you would have like a full workup, like a memory testing, physical, neuro. I believe they also do blood work. For some participants, you can do an LP. And so it's really just like kind of a once a year you come in and we just kind of give you a full workup. And what's great about it and what patients love about it is that you get an annual report, kind of how you're doing. And that gets mailed to you. And the best part is because it's longitudinal, is we track you over time. So the years that you're in the study, we can kind of see trends in your memory scores, in your physical health.
Right.
So that's where, we can learn a lot, and, you can learn a lot too of how you're doing over the years. Right. So that's one of the, studies where we have a control where people do not have any memory impairment. And then we have an impaired group. So we can compare both, but so.
Right. And this study is, it's actually a national study. So there are about 40 national Alzheimer's research centers. We are one of them. And we all compile the exact same data. All of the memory testing, all of the physical examination, the blood work that we may collect. Everyone across the country collects this data in a standardized fashion. And it's all collected in this national database where other researchers can access this data to conduct further research about aging, medical conditions that affect older adults. There are a variety of things that this data can be used for, but it's all coded and de-identified, so researchers will not know who you are, where you live, and those sort of things. But it greatly benefits the world of Alzheimer's disease, because we can naturally observe how people age and maybe try to identify the things that cause someone to develop Alzheimer's disease, because inevitably we do find individuals that have been a part of our program for 10, 15 years that start off with no cognitive impairment, and then somewhere down the line they do. So for us, it's really helpful to try to understand or identify what caused that change in our participant, but of course, across all of the data, what can we learn from aging older adults?
Absolutely.
And we've had whole families be part of the study as well, where a participant and maybe their children are also part of it as well. So
or siblings, we have some siblings that participate together. So it's really nice. Just to add to what Dr. Talixon was saying about that report, it's a nice way to not only track yourself, but for those individuals that do have a cognitive impairment, we do provide an individualized treatment plan. So it's a medical management plan for your impairment. Again, as a research center, we can't provide you with the medical care, but you can take that back to your private neurologist or your private primary care doctor, and they can implement those medication changes or lifestyle changes that we are recommending.
Very good. And then I would just like to add on to that, you know, for people who just want to dip their toe in the research or world, we have Consent to Contact, which is a research matching recruitment registry. And this is a really good opportunity for people to sign up. They enter in some information about themselves, and then investigators who are doing studies on campus at UC Irvine can be matched with people who are interested in research. Do interview studies or online surveys or observational longitudinal studies like the one Beatrice and Melanie spoke about, or clinical trials. So it's a really great opportunity to get involved and kind of decide what you'd like to do. And information about it is there. UCI.edu. Okay, and with that, I think we're coming up against the half hour, so I just want to thank you both for imparting your wisdom about clinical trials. Thank you for joining me.
Thank you, Megan.
And thank you to our audience for watching. If you're interested in seeing this episode and others in the Ask the Doc series, you can visit our website at mind.uci.edu/mindcast. And also, if you're interested in learning more about the studies that Dr. Talixon and Mrs. Videz are a part of, you can go to our website at mind.uci.edu. Finally, if you're interested in participating in the Consent to Contact, you can go to c2c.uci.edu. All right, folks, we'll see you next month. Thank you for joining me. Take care.
Bye.
Bye-bye.